Hi, and welcome to today's webinar. My name is Jackie Thelian. I'm a certified professional coder, certified professional instructor, and certified chart auditor from two certifying organizations. I'll be your presenter for today. We have a busy agenda for today as we will go over the updates, the guideline changes, and Chapter 22, which is new this year. It's important to note the ICD-10 CM codes we review in this presentation do not go into effect until October 1, 2021. As you can see, there are a total of 595 changes, including updates, deletions, and revisions. With the limited time for the presentation, we will go over the most notable. I have included two attachments with this presentation. The first is the 2021 ICD-10 CM Official Coding Guidelines. This is a must-read as it includes chapter-specific guidance on how to code certain diseases, illnesses, or injuries. It also includes coding guidance on how to interpret and utilize the coding conventions utilized throughout the ICD-10 CM manual. This slide and the next slide include the number of new, revised, and deleted codes for each of the ICD-10 chapters. Chapters with no changes are not listed. As usual, some chapters will have more changes than others. On this slide, you will notice that Chapter 19 and 20 include a bulk of the changes, which include mostly new codes. Most interesting this year is that ICD-10 added a new chapter, Chapter 22, for codes with special purposes. This chapter includes two codes, one for vaping and one for COVID-19. We will look at those codes in more detail a few slides down. Okay, so let's take a look at some of the most notable codes and changes in the various chapters. In the infectious disease chapter, Code A84.8, Other Tick-Borne Viral Encephalitis, which was an unspecified code, is now replaced by separating each disease and providing them with separate diagnosis codes. The most notable changes in this chapter are the new and detailed codes for sickle cell anemia. These codes include complications associated with sickle cell and hemoglobin C diseases. These codes now include instructional notes. For example, a note for new sickle cell thalassemia, code D57.418, sickle cell thalassemia unspecified, with crisis with other specified complication, instructs the coder to code any identified complications such as the cholecystitis, K80, or priapism, N48.32. The coding convention of code also and use additional code alerts you that two codes may be necessary to fully describe the condition and provides the sequencing rules on how to list the codes when reporting. With code also, the additional code is reported if applicable. Use additional codes are found in the tabular list, and they represent codes that are not part of an etiology manifestation pair, where a secondary code is useful to fully describe a condition. The sequencing rule is the same as the etiology manifestation pair, use additional code, which indicates that a secondary code should be added if known. This chapter also includes an expansion of category D84, other immunodeficiencies, and this is used to describe the cause of the immunodeficiency. The endocrine chapter includes new coding instructions to follow for diabetic patients treated with insulin, oral hypoglycemics, and injectable non-insulin drugs. For example, If the patient is taking both insulin and an injectable non-insulin anti-diabetic drug, assign both the Z79.4, long-term current use of insulin, and Z79.899, other long-term current drug therapy. If the patient is taking oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, assign code Z79.84, long-term current use of oral hypoglycemic drugs, in addition to code Z79.99. At this point, I want to just stress how important it is to read the coding guidelines. The coding guidelines are located in the front of the ICD-10 manual, and they act actually as an instructor for you. If you're not sure how to code particular conditions, illnesses, or injuries, if you're not sure of a sequencing rule, if you're not sure what those coding conventions mean, all those answers can be found in the guideline section in that ICD-10 manual. In this example, we see here there's a diabetic type 2 with no complications, and normally only on oral metformin, is given insulin for 3 days to maintain glucose control while in the hospital recovering from surgery. In this example, although the patient was given insulin for a short time during his hospital stay, the intent was only to maintain the patient's glucose levels while off his regular oral hypoglycemic medication and not for long-term use. So no code is needed for long-term use of insulin, but a Z code for long-term use of an oral hypoglycemic should be added to identify the chronic use of this drug. As you can see, this example comes from Optum's ICD-10 CM Expert for Physicians Manual. It's important to choose your coding books wisely. Not all coding books are the same. This edition includes the guidelines as well as color coding, diagrams, along with illustrations and examples, as you see here, of coding scenarios. So before you purchase your ICD-10 book, take a look at the different vendors, take a look at the different types of ICD-10 manuals, and choose the one that's right for you. Okay, moving on to Chapter 4. Aromatic 1 amino acid decarbolase, or AADC deficiency, is an inherited disorder that affects the way signals are passed between certain cells in the nervous system. Signs and symptoms of AADC deficiency generally appear in the first year of life. So these are the two notable codes for this chapter as well. Moving on to Chapter 5. This chapter contains 21 new codes, and they describe withdrawal from substances, including alcohol, cocaine, and opioids. Listed on this slide are some examples. You'll find many of these new codes throughout the chapter, and they're also included in your handout. All of them, the ICD-CM codes for this particular chapter, will be in there. Under G71.2, congenital myopathies, the associated conditions are deleted and are assigned subcodes. For example, Nemeline myopathy is deleted from congenital myopathy and is assigned its own code of G71.22. Again, I just want to take a minute and point out some of these coding conventions you'll see here. And these are different from manual to manual, but here you have the little check mark and it's telling you that you need to add some additional digits. Notice the strike through, right? So these are all taken out of the congenital myopathies, and you can see here then you're associated down to get that additional digit, and here's your Nemeline. And you're going to see in this particular manual that they make these changes in green so you can see the difference between the codes. Again, another thing to point out is that you want to make sure you're going to get the book that's color-coded, because it does help you as you're choosing your selection. Okay, Chapter 6. Additionally, under category G96, there are several new codes that relate to other disorders of the central nervous system. This now allows for coding certain conditions of the central nervous system with more specificity, such as intracranial hypotension, perineural cyst, and cerebral spinal fluid leak. Again, you can see the differences here as they're outlined. Notice the difference in the character code when you change the code number. 1 is cranial, 2 is spinal, and 8 is other for cranial, and 9 is other for spinal. So each time we change a digit or a character, we're getting some additional information about that code. Okay, Chapter 7, there's 29 new codes in this chapter. Many of them speak to laterality. So you can see how perhaps making one change, right, now that we have the laterality, results in 3 new codes. And it's important to note that before you use that unspecified code, especially when it applies to laterality, that the examining provider must indicate that affected anatomy. Many of the payers are now denying claims when you use an unspecified code when laterality does exist. Each year, I would imagine, as ICD-10 progresses in areas where we don't have laterality, you can see we're starting to add them in. So although this chapter has 29 new codes, you can see they all reflect laterality. Okay, here I want to point out J82, pulmonary esophilia, not elsewhere classified. The associated conditions are deleted, and new codes are assigned to identify specific types, such as chronic, acute, or esophilic asthma. Again, you're going to see that strike through like we saw before, right? So they're eliminating these and they're giving you the newer codes down at the bottom. J82.83, I want you to make note of the word other when you look at J82.89, other pulmonary esophilia not elsewhere classified. Okay, so codes that are titled other or unspecified are for use when the information in the medical record provides detail for which a specific code does not exist. So in the alphabetical index, they're listed as NEC or not elsewhere classifiable, and listed underneath the code, as we see here, are conditions for which other would be selected. So for example, J82.89, I could report that code whether it was for allergic pneumonia, Loftus pneumonia, or topical pulmonary esophilia, NOS, or not otherwise specified. There were only 11 new codes in this chapter. Chapter 11, Diseases of the Digestive System, happens to be one of the shorter chapters in ICD-10. And category K20, esophagitis, now includes 4 new codes. And category K21, gastroesophageal reflux disease, otherwise known as GERD, includes 2 new codes. The key focus here are the words with or without. This chapter also includes 2 new codes for specific functional intestinal disorders, K59.81 and K59.89, and 3 new codes that are related to hepatic fibrosis. The new codes describe the stage of the disease as either unspecified, early, which is defined as F1 or F2, or advanced, which is defined as F3. Fibrosis stage stratified on liver. Biopsy to stages 0 to 4 using the Metavar scoring system. F0, no fibrosis. F1, portal fibrosis. F2, periportal fibrosis. F3, bridging fibrosis. And finally, F4, which is cirrhosis. Chapter 13 includes several updates this year, including 12 new codes to define other pathological fractures, M80, 8AX, and M80, 0AX, and updates to include an expanded list of codes for rheumatoid arthritis, as well as primary and secondary arthritis and arthritis caused by trauma. There are new codes in the M24 category for other articular cartilage disorders, disorders of the ligament, pathological dislocation, recurrent dislocation, contracture, and ankylosis. These new codes are scattered throughout the chapter and refer to many other types of these conditions. So you can see wherever they had these codes, for example, age-related osteoporosis, they came out with a code for other. Okay, articular cartilage disorders, other specified site. So again, when you look at the manual, or if you pull down that handout that we include that has the raw data for ICD-10, you're going to see that most of the codes in this category are referring to other. The genitourinary chapter includes new substages to stage 3 chronic kidney disease, CKD. This is probably one of the biggest changes in this chapter. The new codes further define the stage 3 or moderate kidney disease. The new codes are N18.30, chronic kidney disease, stage 3, unspecified. N18.31, chronic kidney disease, stage 3A. And N18.32, chronic kidney disease, stage 3B. A new section, 15.S in the guidelines, provides instruction on reporting COVID-19 infections in pregnancy, childbirth, and the puerperium. For example, when a newborn tests positive for COVID-19 and the provider has not documented a specific method of transmission, we're instructed to use code U07.1 and the appropriate codes for associated manifestations. Code P35.8, other congenital viral diseases, would be followed by U07.1 when the provider documents that the newborn contracted the disease in utero or during both. Just as a note and a reminder, codes from Chapter 15 always come first. They take sequencing priority. In addition to the guideline updates, under O99.89, other specified diseases and conditions complicating pregnancy, childbirth, and the puerperium, 3 new codes are added to differentiate that affected stage, whether it's during pregnancy, during childbirth, or complicating the puerperium. And again, we have more information that's new from the guidelines section. And this provides coding guidance on how to code for the newborn with COVID. P35.8, other congenital viral diseases, followed by U07.1, when the provider documents that the newborn contracted the disease in utero or during birth. There were only 4 codes added to this section, signs and symptoms, and they the most notable actually refer to headaches. So code R51 headache is now going to be split into 2 codes. R51.0, headache with orthostatic component, meaning caused by posture, not elsewhere classified, or R51.9, headache unspecified. The remaining 2 split the elevation level of transaminase and lactic acid, or LDH, into 2 separate codes. Chapter 19, injury, poisoning, and certain other consequences of external causes. These are your S to T codes. If you recall on the earlier slides, these have the most changes this year, and these are 2 of the biggest sections of ICD-10. So since quite a few of the 128 new codes in Chapter 19 refer to adverse effects, which are located in the table of drugs and chemicals, let's just take a few minutes and go over the coding guidelines for this section. So this particular table contains an extensive list of drugs, corrosive gases, pesticides, everything that's listed on this slide, industrial solvents, and other toxic agents. And here is the table that you would see when you go to this in your ICD-10 manual. The first column is used to code the substance, right? We see it listed here, that substance that's used or involved in the poisoning situation. And then we have 6 columns, and these 6 columns are grouped under the heading external cause, or your T code. And they identify the circumstance under which that poisoning occurred. So, for example, one of the columns was accidental poisoning. That can mean an incorrect use of medical or surgical procedures, or the ingestion of a drug due to incorrect administration. These are your accidental overdoses. Your therapeutic use is an adverse effect or reaction that comes from a drug that was administered properly, either therapeutically or prophylactically. A suicide attempt is just that. You took this particular substance to cause self-injury. Assault codes is when they are purposely inflicted upon a person. Undetermined is when the cause of the poisoning or injury, you can't tell whether it was intentional or accidental. Underdosing. This is important. That's when the patient takes less of a medication than prescribed. And when you're documenting underdosing, you want to be able to include whether this was intentional, unintentional, or non-compliance, and it might be due to financial hardship or age-related disability. So, for example, a lot of the seniors today, unfortunately, have to choose between feeding themselves, paying their rent, or taking their medication. So they feel that cutting that dose or that pill in half will make it last longer, but it does result in underdosing, therefore not giving the therapeutic effect of the medication as was prescribed. So it's important to capture this information. Okay, so we want to make sure here that you don't code directly from the table of drugs, right? You want to be able to take the codes that you find from that table, and you're going to bring it back to your tabular list. And here we can see on the table of drugs and chemicals the start of the new codes for adverse effects and poisoning. This is by fentanyl. We have it for tramadol, as well as many other the synthetic narcotics that's included. So you can see across the table, this is one of the new codes. Here we can see the codes with their full descriptors as they appear in the tabular section of ICD-10. Again, you get your little check marks here telling you that you need an additional digit or an additional character, and notice the green, right? This is for fentanyl, and now we need to choose whether it was accidental, intentional, assault, so on and so forth. So these prompts are very good to look for when you're choosing your ICD-10 manual. Again, included in Chapter 19, there's 20 codes that define the complications of corneal transplant, and these will further define that anatomic location as being right, left, bilateral, or unspecified. So again, you can see here, additionally, was this a rejection? Was it a failure? Was it an infection? When you make one of these changes to one of these codes, notice it impacts 4 codes for each of these. And that's where those numbers start to seem so high. And this continues to list the various types of complications and specifies either the left, the right, or bilateral or unspecified of the eyes as well. And this is giving you your other or unspecified. This is another chapter that has numerous additions. There's 125 to be exact. As we did on the previous chapter, let's take a few minutes and talk about the external cause codes to refresh our coding memory. So here we can actually see how some of these came about. On the external causes, these are not primary diagnosis codes. They just provide data for injury and research and evaluation of injury prevention or strategies. These are your V codes and your Y99 codes. And these are used to just send information to the carrier of how that injury occurred, where it happened, the activity, the event. And this is really important because what this does is it provides a lot of information to the carrier as to who is the payer of this particular claim. So, for example, if the event occurred during a car accident, right, that would send a clear message that no fault would be the payer. If this happened when I was at work, it would send a clear message this would be a workers' comp claim. If this happened at home, obviously my insurance would be the one to pay for it. But the key thing is that these external causes just give us additional information, and they are not primary codes. Okay, so when we start to take a look at these in Chapter 20, we see that we have many new codes dealing with micromobility gaining more and more popularity and involving accidents. ICD-10 now includes codes to describe those types of accidents in those types of situations. So micromobility refers to a range of those small, lightweight vehicles that are operating at speeds typically below 25 to 15 miles per hour, and they're driven by users personally. Micromobility devices include those bicycles, the e-bikes, electric scooters, electric skateboards. So you can see that although there's 125 new codes, most of these refer to the various circumstances and type of micromobility devices in relation to the type of accidents. So here you have a pedestrian that's standing on an electric scooter that was injured in collision with a car, a pickup or van, and it's unspecified whether this happened during a traffic or a non-traffic accident. Here we can see that we have a pedestrian on other standing micromobility pedestrian conveyance. So this might be one of those other types of devices we were talking about. Okay, Chapter 21. The three new codes for this chapter are listed on this slide, and they describe the observation for suspected foreign body, which was ruled out. And here we're going to go to our guidelines to get some more information about how to use these codes. And the guidelines state that the observation codes are primarily to be used as a principal first listed diagnosis. So this language creates a second exception to the rule that observation codes are primary, and the guidelines state an observation code may be assigned as a secondary diagnosis code when the patient is being observed for a condition that is ruled out and unrelated to the principal first listed diagnosis. For example, a patient might present for treatment following injuries sustained in a car accident, but they could also be observed for suspected COVID-19 infection that was subsequently ruled out. And this slide lists the guidelines and the example that we just discussed. Chapter 22, last but not least, is the addition of a new chapter in ICD-10 to capture codes for special circumstances. And this new chapter has two codes, and you can see this is relating to vaping and COVID-19. And this slide lists the code for COVID-19. Look at the excludes. There's an excludes 1. So if the person had coronavirus infection unspecified, we're going to B34.2. If it was coronavirus as the cause of diseases classified elsewhere, it's B97.2. and pneumonia due to SARS-associated coronavirus is J1281. So it's telling you here, right? We have our U07.1 COVID-19. Anytime you see these excludes notes, it will tell you where to go to find this specific code for something that is not actually the COVID-19. Here you can go in summary. I'm going to give you links on our website as well where you can download the 2021 coding guidelines. Again, must read. This will tell you how to code any type of situation. And the 2021 code tables and index in PDF format. That's actually the entire ICD-10 manual. You can also get it off of CMS's website, which is listed here. This is what I like to call raw data. It's just giving you the codes and the numbers. So you don't have a lot of those fancy coding conventions that we saw here. You don't get a lot of the color coding, things that kind of make it easier for you to code these specific diagnoses, illnesses, or diseases. So I want to thank you for attending, and I hope you found this information to be helpful.